Hi, this is Stephanie of Snikowski Insurance, here to review how Medicare works with group health insurance coverage and the coordination between the two benefits. When you are still actively working and turning 65, the first thing to determine is what is the size of your employer. In this slide, we're going to cover if the employer has more than 20 employees. The employer plan would be primary with Medicare secondary. You can enroll in Part A, however, you cannot contribute to your HSA account once your Medicare coverage begins. You can delay enrollment into Part B due to having the employer-sponsored health insurance. At the point that there is a change in enrollment on the employer-sponsored health plan, this is a qualifying event to enroll in Medicare with no penalties. If you want to delay enrollment into both Part A and Part B, you don't have to do anything. For further clarification on the size of your employer, you may want to reach out to your employer benefit manager. If the employer health plan has less than 20 employees, it is important to sign up for both Part A and Part B when you are first eligible. Medicare is the primary payer and pays before any other coverage. If you don't enroll when you are first eligible, you may pay a Part B penalty. You may also get a premium discount from the employer if enrolled with Medicare as primary. It is important to follow up with your employer's HR benefit manager for clarification. The employer health plan and how it coordinates with Medicare Part D prescription coverage. The first thing to determine is the employer coverage credible? The employer is responsible for mailing out a letter each year by October 15th to advise if the health plan that they offer to you is credible. If you don't recall receiving the letter, check with your employer's benefit manager. If you decide not to get Medicare drug coverage when first eligible, a 1% penalty may be applicable for each month not enrolled. So it would be 1% of the average monthly prescription drug premium times the number of months the late enrollment was delayed equals the cost of the penalty that is ongoing each and every month. Here are some factors to consider when choosing between COBRA or Medicare. Due to the COBRA premium cost, it may be more cost-effective to go on Medicare. It is important to review and compare your options between the employer COBRA benefits and what your Medicare cost and benefits would be. COBRA is not credible coverage with Medicare. We'll explain this in more detail on the next slide. Medicare does not consider COBRA employer coverage. And we'll again review this in more detail on the next slide. Election to Part B must be made within 8 months of losing your group health plan coverage. Medicare would be considered the primary and your COBRA the secondary. It is also important to consider the cost for your spouse who may be under the age of 65 and dependents who may need ongoing health insurance coverage and reviewing their options. What is the Part B COBRA trap? COBRA is not credible with Medicare. So what this means is when COBRA ends, It is not considered a special enrollment to get on Medicare Part B. Once the COBRA runs out, you must wait to sign up during open enrollment, which runs from January 1st to March 31st each year. The coverage for Part B would not begin until July. Electing COBRA and delaying the enrollment into Part B disqualifies you from the 8-month grace period. A late enrollment penalty will be permanently added to the Part B premium. Part B premium penalty is 20% of the standard premium, and you'll have to pay this as long as you have Part B. To avoid this trap, elect Part B when you have worked past the age of 65 and you're going to retire, or you've been laid off, or you've accepted a buyout, versus enrolling in COBRA benefits. This slide is an overview of the prior slides in a grid format. If your employer has 20 or more employees, the employer coverage would be primary with Medicare secondary. If the employer has fewer than 20 employees, Medicare's primary and the employer plan is secondary. If you continue on your spouse's insurance, also know the number of employees. If it has 20 or more, employer's primary, Medicare secondary. Spouse's insurance has fewer than 20 employees, Medicare primary, employer plan secondary. And COBRA, if COBRA is elected, Medicare is primary with the COBRA plan as secondary. This presentation is just an overview of the few scenarios that can impact you and your family as it pertains to Medicare and the group insurance plans. It is important to refer to your Medicare New Handbook on page 20 for more specifics. You can also reach out with your particular circumstances by calling or emailing me. You may also compare Medicare rates via my website at www.insurewithss.com. Thank you for taking the time to view the presentation.